Recording in progress.
Okay, well, we're all set here. Got the record button pushed. And so welcome, everybody. Sorry for the delay. We're about 10 minutes late, but due to technical difficulties, we've got a couple of MD degrees here working on a technology that we're not necessarily, we're a lot better with medicine than we are with IT. So welcome to the first in what I think will be a great series of just conversations between myself and health practitioners of different varieties and about why Redox for them, why are they sharing Redox with their patients. And I think for those of you who are listening who are medical professionals of whatever variety, whether you're an MD or a DO or an RN or a massage therapist or whatever, I think you'll get some useful information from our conversation. So I'm going to welcome Dr. Aaron Kaufman, who is a family practitioner, general practitioner from Albuquerque, New Mexico, who has been affiliated with Redox and ASEA for about as long, maybe longer than I have, and is just a wonderful resource for talking about why Redox and why health practitioners should be ombudsmen for this technology. That's certainly one of the reasons I got involved, because I saw the power of this technology and I realized that it really deserved to be promoted and validated by those of us in the profession, because it would help a lot of people to feel comfortable with using the technology. So Aaron, tell us a little bit about yourself and your background, and how did you get engaged with and involved with this in the very beginning?
Thanks, Dick. Oh, I've got feedback. I'm getting feedback. Is it come there? It's gone now. Okay. Well, I been in integrative family medicine for 35 years here in Albuquerque. Had 4 clinics and so forth. And, from the get-go, even before I went to medical school, I realized I wanted to, there was no such term then, but I wanted to have an integrative practice, what people call functional now. There's all kinds of names, but I wanted to integrate all kinds of other practices from around the world that were effective, and as well as contemporary stuff, as well as doing mainstream, Western medicine. And so over the course of years, doing all these, quote, alternative as well as mainstream therapies, people were constantly bringing me the latest, greatest juice and antioxidant and so forth. And, just a real quick aside, because I know there's a lot of people who are like me, probably not as dramatically emphatic against doing anything that had to do with network marketing, but I was very averse. I've been involved with some wonderful health products back in the 80s and 90s, and just had terrible experiences with, the misrepresentation and hype and, so forth and so on. And, I've always based what I do on transparency and, forthrightness, honesty, so forth. And so for 15 years, people are bringing me great products probably, but I just said, I'm not going to do any network marketing. That lasted 15 years until a friend, Dr. Krista Edmonds, brought me ASEA, and she said, this is redox signaling molecules. So this is about 8 years ago, a little over, actually, no, about 9.5 years ago. I spent 1.5 years going, no, but she was smart. She kept giving me research articles that ASEA had funded, independent research articles. And for important reasons, they were all athletic. Well, I've been a runner for 35 years. I live in Cedar Crest, New Mexico, above Albuquerque at 7,000 feet. And for, at that time, 16 years, I had been running up from my house at 7,000 up through the Cibola National Forest up to 8,000 feet and back down. And there's 8 places when I'm running up the mountain where I max myself, and I'm just like, I can't get enough air and so forth. And, I love that feeling, to push my limits. Well, all this research, coincidentally, divine orchestration, however you look at it, was about ventilatory thresholds. People, these cyclists hitting their VO2 max, with just exactly what I was doing. And they would go 12% further. And these are independent studies, but really well done. Double-blind, placebo-controlled, randomized crossovers. So, as medical scientists, it's like that got my attention. Mice went 29% further before exhaustion when they were drinking this. Huge metabolic shifts in precursors and intermediaries to Krebs cycle, energy production. So that got my attention, but I still didn't really know what redox signaling was. It's a relatively new area of science. Nobel Prize was won in 1998 for the first time for these Italian researchers who recognized some of these molecules and named them. And so by whatever that would have been 2012, it wasn't much known in clinical circles. Just in the last few years now, there are departments of universities and so forth that are dedicated to this, world congresses and so forth. So that's the setting in which I was introduced to. And so I went to PubMed, to the government's website for all the peer-reviewed medical research, and started looking at research articles to kind of get a concept of this. And I read abstracts for a week or so and started to get a concept of what this was about in terms of, mostly pathophysiology, but just an understanding. And then I finally broke down after a year and a half and started drinking it. Totally inappropriately. I would just drink it on the days I'd run because I thought, oh, this is just for athletes, maybe sick people. Hi, Nancy. And it took about a month, and I was powering up the mountain harder and faster. By 3 months, and this incidentally was a month before I turned 60, I set new personal best times for these trails that at that time had been run 16 years by like 20%.
Wow.
So that was pretty compelling. 4 months, I start sleeping like I hadn't slept in probably 20 years, and pretty much still do, apart from stupid things like injuring my hip and keeping me awake. But, over the next year, and this is an important concept for anybody, but certainly health practitioners, over the next year, I started noticing changes. Things would stop hurting, one thing after another after another. And I would say for the first 4 years of drinking this, I had, things change. I would say the last 4 years or so, I noticed new things every once in a while, but it's more maintaining, what I've achieved. So that was my introduction.
Great. And at what point did you feel, that you digested the science enough to think, wow, this is real. This is pretty incredible technology. It's helping me to run up the mountain better, recover faster. At what point did you start to branch out and feel comfortable with recommending it to others, knowing that as a health practitioner, as a physician, when you start to do that, a little bit, you're going out on a limb. This is something new. It's something hardly anybody knows about. It hasn't gotten the official stamp of approval, so to speak, from that agency we call the FDA, for a variety of reasons. And we can talk about that maybe as we go through here. But at what point did you feel comfortable, talking to others, whether it was family members, friends, or patients? And then how did that eventually, because I know you recommend it to patients, how did that morph into sort of pulling it into the office in one way or another and recommending it as a physician?
Well, just sort of preface, you're authoritative on this, and I'm sure we could both discourse on it for quite a while, but it'll never be approved by the FDA because it's considered a supplement, not a drug.
Right.
So it won't have FDA approval. The facility has FDA approval, but
Well, you know what?
nonetheless, Dick, just like you and everybody else and all the practitioners on the call, it's a progressive thing. So you start to cognate, and this is an important transition point for people utilizing, whether they're health practitioners or lay people, an important transition point in the use or the acceptance of ASEA. You read the science, you hear stories, whatever it is, and it's this exciting concept. So you build, the mental image of, the understanding of what it is. And, that takes you to a certain point. And just as an aside, there's a lot of people who dwell on that and they won't try it for the longest time. They need more science, double-blinded studies, things that tell them about this, that, and the other. And you can, load people up with information all day, and they won't go, yeah, this is great, I'm going to accept it. I'm going to use it. And there's a point at which, wherever that is for you as an individual, where you go, okay, I've just got to try this. And when people have an experience, and that's a whole, field that we could talk about for a long time, using the topical gel works quicker and the drink and so forth and the time frame for that. But once people have that experience, it's like Katie barred the door. Oh my gosh, everything I've been reading about, everything I've been studying is true. So that means this and this and this. That means it'll help in this, situation. And it really does turn on cells, which are foundational to everything we do, So it was a progressive thing. I'm not super proud of it, but when I started sharing it with patients, well, let me backtrack. So I've got this tremendous aversion to network marketing. And here's this stuff that the science is compelling. And now I'm having these amazing experiences with it. And I'm about 4 months in, and I go to Dr. Edmonds and I say, I'm upset. I go, I'm going to have to drink this for the rest of my life. I feel so good. I'm sleeping great. I'm running like an animal, and I'm upset. I'm going to have to do this. And I said, it's not cheap. And she goes, well, she puts my memory is she put her hands on her hips and says, well, if you tell 6 people about it, yours will get paid for it. And I go, oh, but it flipped a little switch. And I remember distinctly, very unprofessionally, the first patient I talked to, they're telling me about something, I don't remember what, and I'm going, geez, this probably will help. And important concept, Dick and I have the experience, anybody who's used this for years, you progressively come to understand more and more and more, that process you were talking about when you're convinced. It's an ongoing thing. You see more, you read more. There's so much research just pouring out. At any rate, you have these experiences, and your concept of what this is gets more and more amazing and mind-boggling, and you become sold. So anyway, I'm using this stuff, and I get to the point where I go, okay, I've got to, I'm going to have to be on it. And it's expensive, and so I'm going to share it. And I network marketing averse. I roll my eyes back and go, I sigh, and I go, I've been using this stuff called ASEA, and they, a bunch of them said, oh, they look up into the right, and they go, oh, like acai, and I go, no. And I give them a little nutshell. Just a story. And I go, I've been drinking this stuff for 4 months or whatever, and I'm, sleeping better, and I don't hurt as much, and I've got more energy and mental clarity, and I'm run up like an athlete, like an animal and so forth. And my prior network marketing experiences, I start talking about the products and they kind of back up either physically or emotionally. People are leaning in and their eyes are getting big. Like when you read a story to a kid and they're just kind of like that. And the first 10 people I talked about it, 2 of them literally raised their hand and said, I want that. I was shocked. The first one I said, you do? So what I came to realize is that this really is a storytelling business. When you share your personal experiences, but any experiences, people put themselves into that situation and go, maybe I could not hurt as much. Maybe I could sleep better, have more energy, so forth and so on, versus explaining the science and giving research articles, out the wazoo. And I'm not saying don't do that, but it's just there's a certain point where people have to transition.
So that's interesting because I think all of us, we're sort of trained to just look at the data, trust the data, and not trust anything that doesn't have the data. And yet, medicine for years and years has been based mostly on observation, not necessarily reliant on placebo-controlled, double-blind, crossover, yada, yada. How many adjectives can you add? We have that, and yet, the most powerful thing that we have to talk to people about this technology is our experience and other people's experiences. And sometimes those experiences happen in a week. Sometimes it takes a number of months, if not years, for those experiences to happen. But we've got plenty of people around that are having those experiences. And I think you and I can probably list a couple of breakthrough, really amazing stories that we heard that at first seemed like unbelievable, and yet when you talk to the people who are experiencing it's obviously not a placebo. There's obviously something going on here that made us kind of look further, and I think that's happened for all of us. But so you started to recommend it, or at least talk to people about it. You kind of broke through that barrier. You got over, at least to some degree, the fact that it was network marketing. And a lot of practitioners say, hey, it's network marketing. I don't want anything to do with it. And what I try to get them to understand is they don't have to engage in the network marketing side of this. They can just engage in the recommending side. They don't have to sign anybody up as an associate. They don't have to build an organization necessarily. But just because it comes to the marketplace like that, it's kind of silly to say no to this amazing technology. And, I remember I used to tell people, if somebody comes to you and tells you about a technology that can help almost anything in the health area to get better, just run the other way, because nothing like that exists. And I've had to eat my words. Too good to be true. Too good to be true, yeah. I've had to eat my words on that one with the SIA, because time and time and time again, in almost helpless situations, this seems to work. But so as you started to kind of got over your network marketing aversion and realized that talking to people about this, wasn't a voodoo type of thing, tell me some of the experiences that some of the people had that you recommended it to, because I'm sure that as you saw those things happen, your level of belief just started going like this, because now it wasn't just you having an experience. It was people that you knew, people you cared about, people that maybe you hadn't been able to help as much as you wanted to with everything else that you were doing. And now you were saying, hey, maybe you should try this Redox stuff. And it was funny because Jerry White, my sponsor, and I, in the early days, we were trying to think, what do we call this? Do we call it stuff, or do we call it, how do we introduce this to people? I introduce it as a new technology, but it was because there's no category for it. It's not really a supplement, although we market it as such. But anyway, whatever you want to call this material, this stuff, this water, this, what did it start doing for people? When you started saying, hey, you might want to try this stuff that that's been superpowering me up the mountain behind my house.
Well, you talked about a whole bunch of stuff. First thing is the whole thing about more and more and more experiences. They're uncountable now. They're just so many. And the generalizations are, and I think when, again, back to the research versus the experience, I think people have to, as they accumulate these experiences and accumulate science, it becomes more of a conviction. It certainly has for me, I know for you. But I think what I first started noticing in the generalizations, Dick, is that everybody has more energy. Everybody sleeps better, has more mental clarity, doesn't hurt as much and so forth. We're not supposed to use medical terms, and apparently pain is a medical term, so we say they don't hurt as much. But there's those generalizations about what most people experience, and very importantly, you don't know the time frame. It took me 4 months to start sleeping better. My sister started sleeping better in 2 months. We had a veterinary researcher from Korea who started sleeping better in 2 days. And so everything is totally individual. But I think they are accumulative experiences, and you do see people feeling better in all kinds of different ways and functioning better. But the real key, and as many people as I've talked about too over the years, and I know you have, I would say every 4 or 5 months, I have personal experiences with somebody who has things you don't see. Miracles, and again, I've got a very eclectic practice. I do a lot of mainstream medicine. I do herbs, homeopathics, glandulars, enzymes. I do prolotherapy and PRP. We just do a whole bunch of stuff that really helps people tremendously. And adding this on is, apropos of what you were asking, it's become part of my armamentarium, but again, without segueing too far into, diagnoses and so forth, I mean, oh my gosh, how many people that had like 3 months to live and their doctors are saying there's nothing more we can do for you, get your affairs in order, and it's 10 months later and they're feeling good and they can't find anything, and now it's 8 years later, and people, I mean, you pick an area of the body, a disease process or whatever, and you have seen amazing results. So, without going too far down that path, it's pretty mind-boggling. It's pretty compelling. So, something that works, Dick, this foundationally, at the cellular level, this euthans cells is what I tell people, for them to conceptualize what's going on. If you were 20 years old, if you were a kid, or, just 20 years younger than you are now, how would your body respond to what you're experiencing, whatever the process is? And, we see those kind of things. So understanding how fundamental this is, and that it makes everything else you do work better, whether it's an herb or a nutritional therapy or exercise, or, I don't want to go into, talking about drugs, but everything works better. So this becomes this foundational piece, and it has become a big part of all my protocols. I have protocols for things like brain injury and dementia, Alzheimer's, and fatigue and fibromyalgia has been a huge part of my practice for 25 years, since I had a couple of years of exhaustion. And, you name it, autoimmunity, so forth and so on. And this is a foundational piece. So it's not, when I'm talking to a patient or a friend or whatever, it's not like this might help you. It's like, here's what I would do. Here's why. This is what I recommend. And an important concept also, people, tend to go, oh, just take ASEA. Well, as you run across too, it's important, the concept, the analogy of somebody's got a knife in their back And you don't want to say, yeah, we got these great dressings that'll soak up all the blood and you'll hardly notice that there's a knife there. At some point, you got to pull the knife out so they start healing. So nutrition and, at least walking, exercise, stopping the poisons that we put into our body that are behind 80% of the metabolic disease we see these days. Those are important too. But, people need to know, not everybody sees me and does my protocols and gets huge results with ASEA. So, there's never been anything that I've ever seen in my 40 years in healthcare that even is remotely like this.
Yeah, I would absolutely agree. In fact, I like to tell healthcare professionals that, if you're not using Redox, it's like trying to play ping pong with your hands behind your back, or darts with a blindfold on. And many times when you've got a patient who's not responding to conventional therapy, seeing all the specialists and everybody's doing everything they can within their realm of practice, and you'd expect that person to improve, and they don't. And then all of a sudden you say, well, maybe you should try these molecules, and all of a sudden, boom, it was somehow it was the magic piece that allowed their body. And I think we have to be clear here. This is not something that cures, heals, or treats anything. It is something that gives your body a foundation for making that happen. One thing that, I was just thinking about this now as you were talking, one thing that ASEA has really reminded me of and emphasized to me is how powerful the body is at healing itself. And, as practitioners, we learn all about these diseases and how to help fix them and all that kind of stuff, but we sometimes lose track of the amazing organism that we are, and how amazing our restorative abilities are, as long as we give our body the tools that are necessary. And I think you and I have come to the conclusion that the biggest, most powerful, most effective wrench in our toolbox is ASEA Redox. And yes, there's vitamins and all these other nutritional supplements, and yes, exercise. You don't want to forget the value of exercise and sleep and all of these foundational inputs. But along with those really, really important foundational inputs, I think you and I think an increasing number of health practitioners are putting on that list to make sure that people are in redox balance.
Yeah, a couple of things, comments on what you're saying. For health practitioners on here, it's probably not a bad place to start if you haven't. Going, geez, I'm really not having much success with Ms. Jones. Wonder if this would help her, just what you were saying. And trying it on your difficult cases, your failure cases. So that's probably not a bad place for them to go to. I spaced whatever the other thing was. I'm sorry.
Yeah,
it'll come to me.
That's a great recommendation.
Oh, I know what it was. It's this concept, based on what you were talking about, Dick, is that you can take perfect care of your body, but hopefully people have researched this, but we are flush with redox signaling molecules when we're kids. 8, 9, 10-year-old cuts or burns themselves, sprains their ankle, 2-3 days, they're fine. I'm going to be 68 Wednesday, and even doing everything right, it's probably going to be a month or two before my sprain heals and so forth, and the cut's fully gone and all that sort of stuff. That is, aging causes a deficiency of redox cell signaling molecules starting at puberty. Maybe I got 15% of what I had when I was a kid. Bodies just don't work as well. And conceptually, you look at the diseases of aging. Who gets cancer? Who gets diabetes, hypertension? More and more younger and younger because of diet and a whole lot of other things. But these are, diseases of aging. You see more and more as we age, which is a deficiency of redox cell signaling molecules. Our cells don't work as well. So again, this concept of what would happen with this patient or this friend or family member if we euthaned their cells, made their cells work more efficiently, do what they were, just what you were talking about, designed to do. And I think realistically, Dick, that's what we're seeing.
Yeah, I agree, and there's this concept that I finally wrapped my head around, and that is that the single most important risk factor for any chronic and degenerative disease is cellular aging. That's what's bringing about all of these increases, and we're seeing it, I think, in younger and younger age groups because their cellular aging is accelerated due to environmental factors, a number of different things that, it's really hard to put your finger on one because it's probably multiple inputs. But aging as a risk factor is right up there at the top, and yet, we have research efforts focused on, how can we defeat cancer? How can we defeat this disease? How can we defeat Alzheimer's? We can make the biggest impact we can have on those diseases is to slow down the aging process. And that affects all of those. So, and here we have a product that can actually replace this incredible group of molecules that essentially is our operating system for our cells, and that we know declines as we get older. Why wouldn't you supplement with Redox? And the studies that we've done and studies in the literature show that aging starts, like you said, it starts at puberty. I mean, we start to age. By the time we're in our mid-30s, we could get substantial benefit from this product. We know that from the research. So we're onto something pretty big here. And hopefully health practitioners who are listening in, hopefully some of you are at that cusp of making a decision, and we aren't just speaking to the choir of people who have already agreed with that. But do you want to relate any specific stories about, I'll relate one because it had a lasting impact on me. I went to a network marketing meeting. Do you believe that? And I didn't do it. I did it to see if I could learn something about the science because it was being given by a chiropractor who was actively using this. And he related a story. In fact, the woman was in the audience and I had a chance to talk to her afterwards. And she was in her 70s. Her daughter was in her 50s. Her daughter had a very debilitating neurologic disease and had had it since birth. You kind of probably know what I'm talking about. And couldn't speak, couldn't function, couldn't dress herself, any of that. But her mother had taken care of her whole life. But her mom was getting older and was concerned, what's going to happen when I can't care for my daughter anymore? And so Dr. Smith got both of them started on Redox. And what happened was that the mom all of a sudden got the, better sleep, more energy, wasn't so concerned about the aging issue. But the most amazing thing that happened was that this daughter started to talk to her mom, started to dress herself, started to help her mother make meals. And so all of a sudden, after more than 50 years, she actually had a daughter she could communicate with and get to know. And it was amazing.
Yeah.
And we see those kinds of things and hear about them routinely connected with Redox.
Yeah. I would say to this day is sort of the most amazing set of Redox stories that I've ever seen. And this is available on Alan Noble's Redox, what is it? Real Redox story?
Real Redox results, yeah.
Results, yeah. A couple of neighbors of mine, I was 4 months into drinking this, and I was running by their house one day, and the wife was out in front, and I'd been working with her because she had had a traumatic brain injury from an automobile accident 7 years prior. And this sort of turned me. I was using it, I was starting to share it a little bit, but this is what made me kind of go, wow, I have an obligation to do this. If I see one more story like this in my lifetime, I have to do this. She had a traumatic brain injury. I've been working with her. I do all kinds of stuff, regenerative injections in the neck and, cranial work and nutrition and, hormones and thyroid and all. And I was sure she was going to get better. She languished for 7 years. She had seen 23 doctors before me. She was miserable. She couldn't think clearly. She could hardly walk with more than at most 100 feet with a cane, and she'd turn too suddenly, she'd fall, her equilibrium was terrible. She hurt from her hair to her toenails, everything, 10 on a scale of 10, and was just miserable and would lay in bed 18 hours a day staring at the paint, could only sleep about 2, hurt to chew. I mean, she was miserable. And so I couldn't help her, which shocked me. And I said, why don't you try this stuff? And she definitely had nothing to lose. I sent her videos that she couldn't watch because if things moved on the computer screen, she'd get sick. And she started drinking it, Dick, and I didn't see her for 3 weeks. The next time I saw her, oh, key piece, she would come in and I would talk to her and she would, get maybe a sentence or 2 out, and then she'd just start grimacing because her brain didn't work. She said her words would just run into each other. It was miserable, miserable life. And the next time I saw her 3 weeks later, she did not have her cane. And she was talking, makes my hair stand up. She was talking coherently to two other people. And I'm in tears. I've never seen anything like this. And within 6 months, she's off of like handfuls of meds and so forth. And to this day, I haven't seen her in a long time, but I think she's doing great, but she needs to maintain it. Great story, but that's not the whole story. Occasionally, she would bring her husband in, who I didn't really know anything about. And, I like to ask talking to the patient, ask the family there, and particularly with her, what do you perceive? And I would ask him something and he either wouldn't respond or just go, oh. And I just thought he was surly, Turns out, and I'll find all of this out after the fact. Turns out he at that time is 63. At age 40, they had been living in Seattle. He was a bank vice president, really sharp guy. Age 40, he's playing, one evening he's playing indoor soccer. End of the game, he drops dead. And as an ER physician, he was down 9 minutes. And his wife said, please, to the paramedics, try one more time. They had shocked him how many ever times, I think 5 times. And so they did, and he came back. Mm. And, as you are well aware, and probably most practitioners on the line, after, 4 minutes, you start having anoxic brain injury. So for the next 23 years, he's basically watching reruns. He's pretty useless and he can't be around people, which explains why, he wouldn't answer my questions. So unbeknownst to me, wife's doing so well. She says, you drink this too. And again, he's a heart patient and we live at 7,000 feet, really steep hills. He's walking the dogs and he'd have to stop on the hills. Within a month or so, unbeknownst to me, he's not having to stop on the hills, Yeah. But here's the amazing thing, and this makes my hair stand up too. She's doing so well. She goes to visit her daughter in Huntington Beach down in LA, leaves him on his own and says, you double your dose. I guess probably 8 ounces of ASEA. 4 days later, Dick, he calls her and says, the fog is lifted. She doesn't recognize his voice. She goes, who is this? Wow. After 23 years, this guy woke up. I haven't talked to him in a few years, but he is sharp as a tack. He's funny. He used to teach me stuff on the computer. And I just go, you don't ever see stuff like this. This is like, I can explain it, but it's like miracle stuff. So I went at that point, if there's one more case like this in my life, I have an obligation to do this. So sorry to go long on the story, but it's pretty compelling.
Well, it's very compelling, and the stories, we can, even with health practitioners, I think we can throw all kinds of research at them. We can suggest they go to PubMed and put in redox signaling and and categorize that, and they're going to come up with hundreds of.
We didn't talk about research. But
No, we didn't.
Next time.
Yeah, next time is a good idea. But I think it's really, and again, they say in network marketing, stories sell, and facts don't really take you very far. With health practitioners, we need the facts, or we're not going to tell the stories. We need the facts at least a little bit, or we're not going to create those stories. And to create these kinds of stories, all we've got to do is recommend that people try it. Just try it, because 100% safe. There's no toxicity, and so we don't have to worry about it. And what happens is oftentimes are these really incredible recoveries in people who everybody else has given up on, and yet it also is a great supplement for very healthy people to accelerate their performance on the field. I just got an emergency call from another associate. They're having the Olympic track and field trials in Eugene, Washington. I got a call. Do you know anybody in Eugene? One of the athletes that's out there that takes ASEA forgot his ASEA, and I'm thinking, oh my God! So we were able to get a couple of bottles over to the venue yesterday. Hopefully he competed well. But so it helps the healthiest of the healthy, and it helps the really desperate cases. So why wouldn't you embrace this as a health professional and start?
What I say is anybody who has cells.
Absolutely. If you've got cells, you can benefit from Redox. So I think, this has been an incredible conversation. We'll have to do it again. I know there's other professionals out there that will have pearls of wisdom. And so, yeah, I mean, if necessary, we'll start doing this more often. But thank you, Aaron, for participating.
Thanks for asking me. I didn't realize this was your inaugural call. I'm honored.
Well, I've done PowerPoint explanations, and I still do that. In fact, if you're a healthcare professional and you're wondering, what are we talking about here? What are redox molecules? What's redox signaling? On the first Saturday morning of the month at 8 a.m., if you're up, I do a call where I take kind of a deep dive into the science. But I think what I wanted to do was also have a venue where health practitioners that are using this can explain to other health practitioners of all stripes how they might want to incorporate this into their protocols, into their armamentarium of what they have to offer. And your recommendation of picking out your most problematic patients who are still trying desperately to get better, and nothing's really working all that well, try it on them first. Try it on them first, because that's not only going to help them out in a major way, but it's also going to take you a long way on your journey of understanding and confirming in your own head that this stuff really does work. So thanks a lot. Thanks again. And we'll call it a day.
All right. Thanks, Dick. Y'all have a great day.
You bet. And this recording will be on ASEA United. And if you have any difficulty accessing it, let us know.